welcome to the deep dive. We tend to think of tuberculosis, TB, as maybe a disease of the past, especially here in wealthier countries.
Right, something confined to history books or maybe just happening far away.
Exactly. But what if that's, just not the case anymore? What if our modern world, our cities, are actually creating new risks?
It's a really important point, and the global picture is frankly startling. TB is actually back as the world's biggest infectious disease killer.
Bigger than COVID.
Yeah, much bigger in 2023. We're talking 1.25 million deaths from TB compared to around 320,000 from COVID-19.
Wow. Okay, that completely flips the script on what we thought the major threats were. How did that happen?
Well, a lot of factors, but it means we need to look beyond just seeing it as a problem for lower-income nations.
So our mission today in this deep dive isn't just about those global numbers, massive as they are. It's about uncovering how TB is sort of quietly resurging, finding footholds right here in developed countries, and why that matters to you.
Definitely. The WHO's 2024 report sounded a pretty loud alarm bell. 8.2 million new TB diagnoses globally in 2023. That's the highest figure they've recorded since they started tracking in '95.
Highest ever recorded.
Since 1995, yeah. It really forces us to ditch that old idea that TB is just a quote-unquote third world disease. That view is outdated, and honestly, it's dangerous.
Okay, so where are we seeing this shift most clearly?
Well, Europe is a stark example. A nearly 25% increase in TB cases among people arriving from other countries in just 2023.
25% in 1 year.
And the impact of the war in Ukraine is particularly dramatic. We saw a 316% surge in TB cases among Ukrainian refugees between 2022 and 2023.
300%. That's staggering. It really highlights how global events directly impact health, doesn't it?
Absolutely. It's sensitive, obviously, but you can't ignore the link between conflict, displacement, and disease spread. Look at countries like Malta, Iceland, Sweden. Over 90% of their TB patients are migrants.
And the UK.
The UK, it's about 70% of cases are in foreign-born populations. But here's the really worrying part. Drug-resistant TB.
Yes.
It's up by at least 60% globally. And among Ukrainian populations specifically, the resistance rate is about 25.7%.
Whoa, okay. How does that compare?
That's roughly 5 times higher than in other groups.
5 times. So our usual antibiotics just don't work as well or at all.
Exactly. It makes treatment incredibly difficult, much more complex, and frankly, a much scarier public health threat.
So even if overall national rates seem low, this is bubbling up in certain areas.
Precisely. Think about urban hotspots. In London, you have boroughs like Newham, where TB rates are around 41 per 100,000.
It's 41. That sounds high.
It is. It's comparable to rates in some developing countries. We see similar things in Leicester and Brent.
And this links back to social conditions.
Yeah, often things like poor or overcrowded housing in certain communities. These conditions are perfect breeding grounds for transmission. Remember, just one untreated active case can infect 10 to 15 other people in a year.
So it spreads easily. And the drug-resistant form, that must be a nightmare to treat.
It's a huge burden. Treatment can be like 100 times more expensive than for regular TB. It involves toxic drugs, and it can take up to 2 years.
2 years of difficult treatment. Okay. What about screening? Don't we screen people coming into the country?
We do. Developed countries generally screen immigrants. Screening picks up active TB in about 0.33% and latent TB in roughly 19%.
Latent TB, remind us what that is.
Latent TB means you have the bacteria in your body, but it's dormant. You're not sick, you can't spread it yet.
So it could become active later.
Exactly. It's like a ticking time bomb.
Yeah.
And here's the problem. We identify people with latent TB, but only about 26% actually complete the preventive treatment needed to stop it from becoming active.
Only a quarter? That seems like a massive gap.
It is. It leaves thousands potentially developing active TB down the line. Plus, screening doesn't even reach everyone. It should maybe only 2/3 of eligible migrants and lots of healthcare workers haven't had specific TB training.
So why should everyone, maybe someone listening who thinks this doesn't affect me, why should they care?
Because TB spreads through the air. Anyone can breathe it in. And these drug-resistant strains, they're particularly worrying because our standard defenses are weaker.
And COVID made things worse.
Yeah, the pandemic disrupted healthcare massively. Globally, there's a gap of about 2.7 million people who likely have TB but haven't been diagnosed. Many of those could be here in developed countries walking around undiagnosed.
And bigger global trends play a role too, like climate change, conflicts.
For sure. They drive migration, which inevitably affects disease patterns. And let's not forget, The social factors that help TB thrive, poverty, poor housing, malnutrition, they exist even in the richest countries. TB finds those vulnerabilities.
Okay, so to be clear, we're not saying there's a massive TB epidemic sweeping the general population in places like the UK or the US right now.
No, not in that sense. But it is digging in, creating these persistent, dangerous pockets, especially in vulnerable communities. And it's evolving into these tougher, drug-resistant forms.
So knowing the symptoms is key then. What should people look out for?
The main things are a persistent cough, one lasting more than 3 weeks, maybe chest pain, losing weight without trying, fever, and night sweats. Getting diagnosed early makes a huge difference.
Right. Early diagnosis, better outcome.
Absolutely. And this really underlines that TB isn't history. It's here, now, in our communities. Supporting strong public health, good screening, tackling inequality, ensuring everyone can get health care that protects everyone.
It really brings it home, doesn't it? In this connected world, you can't really separate the health of one community from the health of all. Our well-being is tied together. Something to think about.